My name is Fatima. I'm a fourth-year medical student at Geisel, and I just matched into internal medicine and pediatrics at the University of Michigan, and I'm one of the co-founders of MENASA.
And my name is Omar Sajjad. I'm a second-year medical student at the Geisel School of Medicine, and I'm also one of the co-leaders of MENASA.
We created it in response to seeing that there was a need for a student organization to serve patients, students, and communities of Middle Eastern North African descent.
We want to be there to help any newcomers with developing their English language skills, to get them the proper healthcare that they need, and to also connect them with proper translation services where necessary.
We collaborated with New Hampshire government officials, Geisel administrators, and local stakeholders within the community to develop the Refugee Health Program, which served as a social support network for Afghan refugees in the area. And within that, we had 3 to 4 branches. And so our first branch was developing care packages to welcome the Afghan refugees, and the second of which was to develop culturally competent curricula, because all Afghan refugees were going to come through a Dartmouth health system at some point. And the third was international COVID relief programs to distribute PPE in rural areas internationally.
To connect with people who even speak their native language can mean so much for them. It makes the process just less overwhelming.
People are looking to be heard, and I think when people feel heard, that is a solution. And people think that that's, small and it doesn't really do much change, but I think that it does.
Through my work with MENASA, I got to see health from a different perspective. I got to understand it from sociocultural, geopolitical, and structural perspectives.
It's really important that when you have students, not just in medical education, but at any level, to empower them and to show them that they can do something, that they do have things to contribute. And I think through this work, I was able to feel like not only my identities were valued and important, but also that the studying I was doing in medical school mattered. Who would have thought that a bunch of medical students could do something like this? But I think, it's important to believe in yourself even when other people don't.
I'm in medicine to contribute to something that's greater than myself. We're working on something that's not just for the good of a handful of people, but good for the entire community.
If you're aware of the social determinants of health that impact our patients, then what you know about medicine now matters, and it matters a lot more. And I think that working with people whose energy is contagious, whose passion for this is contagious, I think that we're the type of people to bring change wherever we end up and wherever we go, to the communities we see and to the vulnerable patient populations we work with. And I think that that's something that's important, that it's something that comes from within and not externally motivated.